Hey there, Dr. Luke here, and what we're going to do today is go through ankle dorsiflexion PAILs and RAILs. And so what ankle dorsiflexion is this movement here. This is my active range. I want to get in my passive range to do my PAILs and RAILs. So I'm going to use my weight to get that stretch. I'm going to bring my ankle into this position my weight over the ankle. I'm getting a good stretch there. Sometimes I like to use some blocks so that we're comfortable, because we're going to have to do this stretch for 2 minutes. Sometimes I use a wedge, and this wedge will increase the intensity of that stretch as well. Today, I'm not going to use a wedge. I'm just going to use my blocks so that I can get in a comfortable position to hold my initial stretch for 2 minutes. So let's just put my timer on, and we just want to get that initial stretch for 2 minutes. I'm positioning myself so that I can feel that stretch, but also I'm comfortable so I can, because I've got these blocks beside me just to support me. So after the 2 minutes, we're going to do a PAILs and RAILs contraction. So the PAILs contraction, I'm going to push my foot into the floor. So I'm going to be creating what we call plantar flexion, this movement. So I'm going to be pushing my foot into the floor. My RAILs contraction is going to be immediately after that for 15 seconds. I'm going to try and create my toes to be driving upwards and making the top part of my foot lighter into the floor. So we're going to be doing this movement. So hold that stretch for 2 minutes. We've just gone through into a minute. So breathe into it, relax the tissues around that ankle, trying to get a good stretch through those ligaments and the joint capsule there. Really important that we have good function of our ankle. It helps with that coordination through the feet, knees, and pelvis. And we don't want compensations and potential injuries because of abnormal movement of this joint. So very important, because it creates the foundation of the whole body. So in another 20 seconds, I'll count us in. We're going to drive our foot down into the floor. Isometric contraction. And we're going to push in a really safe but best effort contraction there. So 3, 2, 1, push. And I'm pushing as hard as I can there in a safe contraction. Plantar flexing my foot into the floor. Keep going, keep going. That's it. 3, 2, 1, and opposite contraction. I'm trying to drive my toes off the floor, making them feel lighter. Keep going, keep going. And relax. Now we just relax into that stretch. This is a 45-second stretch here. Try and get more of a stretch there so that we can stimulate different areas of that joint. This stretch needs to be pain-free. Certainly, you're going to feel a stretch and that's going to be uncomfortable, but we don't want any sharpness or pinching through the joint. If that's the case, you need to see a health care professional to work out how to improve that function first of all, and make sure you're ready for these exercises as well. So let's go. 3, 2, 1, another PAILs contraction into the floor. Really push best effort and hard as you can. Keep going, another 5 seconds. 3, 2, 1, opposite contraction. We're trying to lift our toes off the floor there. We're trying to make them feel lighter. And we're really just contracting all the muscles in the front of the leg there. 3, 2, 1, and relax. Okay, now we go more deeper into the stretch. Again, this is going to be a 45-second stretch. Another 20 seconds here. So important, your ankles, to have healthy function of your ankles and ankle joints. And another 5 seconds, and we've finished with 2 sets of PAILs and RAILs with our ankle dorsiflexion. And so that's how we do PAILs and RAILs for dorsiflexion of the ankle. So give it a go.